Welcome to the deep dive. Today, we're taking on a topic that, well, it might not be top of mind when you think about cattle health, but it's incredibly serious and, frankly, a bit insidious. We're talking about tetanus. We've pulled together everything you need to know from a stack of sources, basically giving you a real shortcut to understanding this pretty severe condition.
Yeah, and what's truly critical here, I think, is that despite tetanus having maybe a lower incidence than some other livestock diseases, its impact, well, it can have disproportionately high economic and welfare consequences. Our deep dive really shows just how challenging it is and why grasping its nuances is absolutely key to protecting these animals.
Okay, so let's jump right in then. When we talk about tetanus, what are we actually dealing with at its core? Like, what's the fundamental cause?
Right. At its core, tetanus is a potentially fatal neurological disease. And the culprit, the actual cause, is a bacterium called Clostridium tetani. It's quite fascinating, actually. What makes this particular bacterium unique, even visually under a microscope, is its shape. When it forms spores, it looks like a drumstick or maybe a tennis racket.
A drumstick shape. Huh. And those spores, they're a huge part of the problem, right? What makes them so dangerous and widespread?
Absolutely. The spores are really the key here. Their extreme hardiness and the fact they're found globally. It means that complete eradication of this pathogen from the environment is, well, it's practically impossible. These spores are incredibly resilient. Our sources show they can survive intense steam heat, various common disinfectants too. This lets them just persist in soil for years, and they really are ubiquitous, found in soil across the world, in dust, and maybe surprisingly even in the intestinal tracts of many animals. So this fundamentally dictates our approach. Prevention has to be about managing exposure, not trying to eliminate the bug entirely.
That's a really crucial distinction. Okay. Now, one detail that struck me from the research is how this disease actually spreads. You mentioned it's not contagious animal to animal, like, say, foot and mouth.
That's correct. Yeah, it doesn't spread directly between animals. It's all about wound contamination. Basically, the bacteria enter the body when these hardy spores find their way into certain types of wounds. We're talking about things like deep puncture wounds, lacerations, maybe castration sites, dehorning wounds, or even uterine infections after calving.
Okay.
And what's surprising, and maybe often missed, is that even seemingly trivial wounds, tiny little cuts, can potentially lead to tetanus if they get environmentally contaminated,
Yeah.
especially if the wound creates that oxygen-poor environment the bacteria love.
Right, that anaerobic condition. So it's about those deep oxygen-deprived spots. Are there particular procedures or, situations that cattle owners should be extra mindful of, times when the risk is higher?
Yes, definitely. The sources highlight some common predisposing factors. Calving, particularly difficult births, that's one. It can lead to infections that provide an entry point. And castration is another big one, especially the sources note when it's done using elastic bands. That method creates the kind of tissue damage and lack of oxygen that C. tetani thrives in. So the fact that it's not contagious really shifts the focus, doesn't it? It moves away from herd containment towards, well, meticulous individual animal care, surgical hygiene, and wound management.
Okay, so I've got the bacteria, the spores, how it gets in. But the real damage, the actual disease we see, comes from something the bacteria produces, right? A toxin.
Exactly. This is where it gets really insidious, as you said. Clostridium tetani produces a substance called tetanospasmin, or 10T. It's an incredibly potent neurotoxin.
Neurotoxin, so how does that actually work? How does it hijack the nervous system?
Right, so the toxin gets produced in the wound where the bacteria are multiplying. From there, it binds irreversibly to nerve endings. Irreversibly is the key word. It then travels up the nerves to the spinal cord and the brainstem.
Okay.
And there, its main job is to block the release of inhibitory neurotransmitters, specifically things called glycine and GABA. These are the signals that normally tell muscles to relax. So when they're blocked,
The muscles just keep firing.
precisely, you get unopposed muscle contraction, rigidity, spasms. That's the spastic paralysis characteristic of tetanus. And that irreversible binding part, it explains why treatment is so tough and recovery takes so long. It means you're essentially waiting for the body to grow completely new nerve connections, new axon terminals to replace the ones the toxin destroyed. And that biological process, it just takes time. Weeks, sometimes 4 to 6 weeks, or even longer.
Wow, that irreversible binding really explains a lot. And it ties into the incubation period too, right? I read that can be quite variable, sometimes even hidden.
Exactly. That prolonged process contributes to the often hidden incubation period. The research shows it can range from just 2 or 3 days all the way up to 4 weeks or more. And in some cases, even several months.
Months. Really?
Yeah. So what this means for owners, practically, is that by the time you actually see clinical signs, the original wound that let the bacteria in might have completely healed over. You might not even see it anymore. This hidden progression really underscores why prophylactic measures, preventive steps during high-risk procedures, are so critical. Even if there are no immediate wound complications visible, you just might not know an exposure occurred until much, much later.
That sounds like it makes diagnosis incredibly tricky then. So for you, the listener, looking at your cattle, how do you spot this insidious disease? What are those signs you need to look out for?
Recognizing the signs, especially the early ones, is absolutely vital for intervention. There's often a distinct progression. Some of the early signs are quite pathognomonic, meaning they're pretty distinctive for tetanus. One of the first things you might notice is a prominent protrusion of the third eyelid.
The third eyelid.
Yeah, it's sometimes described as a sort of strange-looking eye blink or a flick across the eye when the animal is stimulated, like by a noise or touch. You might also see a stiff, extended tail. It's often referred to as a pump handle tail because of the rigidity.
Okay, a flicking eyelid, a stiff tail.
Yeah.
What else early on?
There's also just generalized stiffness, maybe a reluctance to move. Sometimes mild bloat can be an early sign too. Muscle tremors and hyperesthesia, that's an increased sensitivity, being jumpy to touch or sound.
And then as the disease progresses, I imagine the symptoms get much more severe and recognizable. What does that look like?
Oh, absolutely. As it advances, the picture becomes much more alarming. Yeah. You'll often see the characteristic sawhorse stance. Yeah, where the animal stands with all four legs rigidly extended, sort of braced. Then comes lockjaw, or trismus, which makes it incredibly difficult, sometimes impossible, for the animal to eat or drink. In the advanced stages, things get really bad. Animals might collapse on their side with their back arched. That's called opisthotonos. Severe bloat is common because the rumen muscles get paralyzed. Dysphagia, difficulty swallowing, convulsions can happen too.
Yeah.
And ultimately, death often results from exhaustion, severe dehydration, or respiratory failure because the breathing muscles are affected.
That sounds horrific.
It is, and it's important to note, sometimes producers report sudden death as the first observed sign, just because those earlier, maybe more subtle indicators were missed.
That progression from maybe a subtle eye flick to a collapsed animal, it really hammers home the urgency. Catching it early seems absolutely paramount.
It absolutely is. Recognizing those initial, often quite specific signs really highlights that critical window for veterinary intervention, especially because secondary complications like bloat can set in so rapidly and be fatal on their own. Swift action is essential.
Okay, so you see these alarming signs, you called a vet immediately. But you mentioned earlier, even for the experts, diagnosis isn't as straightforward as maybe doing a blood test. Why is it such a challenge?
You're right, it's far from simple. The big challenge is that there are basically no reliable lab tests for definitive confirmation, while the animal is alive ante-mortem confirmation. This forces a really strong reliance on clinical judgment. The veterinarian's observation skills, their ability to see those specific signs we talked about, and getting a really detailed history from the owner, those become the primary diagnostic tools. They're critical.
Why are the lab tests so difficult with Clostridium tetani? What are the specific limitations there?
Well, there are significant limitations. For one, trying to isolate the Clostridium tetani bacteria from the wound is tough. It's an obligate anaerobe, meaning it hates oxygen, so culturing it is tricky. Plus, it often grows as this thin, almost transparent film on the agar plate, which can be easily missed in the lab. So even if a culture comes back negative, it doesn't definitively rule out tetanus. There is a definitive lab test, mouse toxicity testing, where you inject material into mice. But obviously that's not rapid, and it's certainly not something you can do out of the field for an immediate diagnosis.
Okay.
And looking for antibodies in the blood, serodiagnosis, that's not really relevant for diagnosing an active, ongoing case of clinical tetanus. It might tell you about past exposure or vaccination, but not about the current disease state.
So if the labs can't give a quick, definitive answer, that puts even more pressure on the vet's clinical observation, doesn't it? Are there common misdiagnoses, things that look similar?
That's an excellent point. It absolutely puts more pressure on clinical acumen. And the challenge is compounded because the neurological signs of tetanus can overlap significantly with a whole bunch of other conditions. A vet has to differentiate it from things like rabies, listeriosis, polencephalomalacia, or PEM, even salt poisoning, or grass tetany, which is actually a metabolic issue, hypomagnesemic tetany. Even botulism can look similar in some ways, though that usually causes flaccid paralysis, not the rigid kind like tetanus.
Wow, that's quite a list. Imagine trying to sort that out in the field. It really is like a medical mystery sometimes.
It can be, yes. A thorough history and careful, repeated observation are just crucial.
Okay, so let's say the vet, using their clinical judgment and history, makes a diagnosis of tetanus. What happens next? Is there a magic bullet cure? The sources seem to emphasize prompt diagnosis and immediate treatment are critical.
Yeah, immediate action is key, but unfortunately, there's no single magic bullet. The core treatment strategy is really multi-pronged. First, there's tetanus antitoxin, or TAT. This contains preformed antibodies that can neutralize any circulating tetanus toxin that hasn't bound to nerve endings yet. But, and this is crucial, its usefulness is very limited once the toxin has already bound irreversibly to those nerve endings. So its highest efficacy is really only when it's given in the very early stages, ideally before major neurological signs kick in.
Okay, so antitoxin early on. What else?
Second, antibiotics. Their role is to eliminate the source of more toxin production, meaning killing the Clostridium tetani bacteria still active in the wound site. But again, it's important to remember, antibiotics do not neutralize toxin that's already circulating or reverse any neurological damage that's already happened. Penicillin and metronidazole are often the preferred choices here.
Right, so antitoxin for circulating toxin, antibiotics for the bacteria, but that doesn't fix the nerve damage. That sounds like where the real dedication comes in, the supportive care.
Exactly. That comprehensive supportive care is, as the sources say, paramount for survival. It's not just about a shot or a pill. It really is a marathon of care, like you said.
So what does that actually involve? Can you walk us through it?
Sure. It involves several key things. First, meticulous cleaning and debridement of the wound, if you can find it. You want to open it up to oxygen and remove dead tissue to stop the bacteria from thriving. Second, fluid and nutritional support are essential. Affected animals often can't eat or drink because of the locked jaw and muscle spasms, so they might need IV fluids, sometimes even liquid feeding through a stomach tube.
Okay.
Then you need to manage the muscle spasms themselves. This usually involves sedatives and muscle relaxants, things like diazepam or methocarbamol, and crucially, minimizing external stimuli. Keeping the animal in a quiet, dark, calm environment, maybe a padded stall, can help reduce the frequency and severity of the spasms. Any sudden noise or light can trigger them.
Right. Keep everything calm.
Yeah. And finally, preventing secondary complications is critical. Bloat, as we mentioned, is a really common and potentially fatal complication. So maintaining recumbent, down animals in a sternal position, chest down, helps with that. And frequent turning, ideally at least 3 times a day, is needed for those down animals to prevent pressure sores from developing.
Wow. That sounds like an incredible commitment of time, resources, and just sheer effort for the animal and the owner.
It absolutely is. It really highlights that managing tetanus is incredibly labor-intensive, resource-demanding. It takes a team effort, often. And even with all that intensive care, the prognosis is generally poor, particularly once those clinical signs become advanced.
Poor prognosis. What does that mean in terms of survival rates?
Well, mortality rates, especially in calves, can be very high. The sources often cite figures reaching 80% or even more.
80%, wow.
Yeah. And even for the animals that do recover, the process is really protracted, often taking several months. That's because of the slow nerve regeneration we talked about earlier. They need time to rebuild those damaged connections.
Okay. Given how incredibly tough tetanus is to diagnose, how intensive the treatment is, and the poor prognosis, it just becomes crystal clear that prevention isn't just a good idea, it's absolutely essential. So what are the actionable strategies? What can you actually do?
You've hit the nail on the head. Prevention is everything with tetanus. And the cornerstone, the absolute foundation of long-term prevention, is active immunity through tetanus toxoid vaccination. It's known to be highly successful and protective. Our sources are clear. Tetanus rarely occurs in properly vaccinated animals.
So how does the vaccination protocol usually work?
Well, for long-term immunity, often a primary course is recommended, maybe a 3-dose course, which can provide protection for over 3 years. Or for animals that haven't been vaccinated before, a booster series, usually 2 shots given 3 to 6 weeks apart, is needed to get that immunity established. And it's specifically recommended really strongly for bull cows undergoing castration, since we know that's such a high-risk procedure.
Okay, so vaccination is the key long-term strategy. What about immediate protection? Say if you have an unvaccinated animal that just got a nasty wound or is about to undergo a risky procedure like castration.
Good question. For that immediate short-term protection, that's where passive immunity using the tetanus antitoxin, TAT, comes in again, but this time used preventatively. It provides immediate but short-acting, maybe up to 21 days, passive immunity. It buys you some time during those high-risk periods for an unvaccinated animal.
Got it. So vaccination long-term, antitoxin for immediate risk. What else?
Beyond immunity, surgical hygiene and aseptic techniques are absolutely paramount. Remember, many cases are iatrogenic, caused by procedures, or directly wound-related, so they are highly preventable. This means using strict aseptic technique for all procedures: castration, dehorning, tail docking, and especially paying attention to hygiene during calving assistance. Clean instruments, clean environment.
Makes sense.
And lastly, just good general biosecurity measures play a role too. Things like isolating new animals, controlling traffic onto the farm, regular sanitation of equipment and feed areas, proper carcass disposal. These all indirectly help by reducing overall stress and the potential exposure to contaminants like C. tetani spores in the environment. It really shows how a holistic approach to farm health benefits specific disease prevention efforts too. It makes the whole operation more resilient.
We've definitely unpacked a lot today, from drumstick-shaped bacteria and hardy spores to sawhorse stances and that whole intricate dance between the toxin and the nerves. The big takeaway for me, I think, is just how sophisticated this disease is, how challenging it is, and how much it demands in terms of veterinary skill and, crucially, owner vigilance and prevention. It really underscores the power of being proactive.
Absolutely. Ultimately, this deep dive just reinforces that proactive prevention through vaccination and meticulous hygiene isn't just, a best practice. It's really an absolute necessity for safeguarding cattle health, their welfare, and ultimately agricultural productivity too. And it raises an interesting question, doesn't it? What other seemingly rare diseases might actually have disproportionate impacts that perhaps warrant a closer look in your own context, even if they aren't the ones making headlines every day?
That's a great final thought, something to definitely ponder as you continue your own deep dives. Thanks for tuning in.